Today's video will be on vaginal odor. You should bear in mind that it is normal for the vagina to smell because it stays in a warm and dark place loaded with lymph nodes and glands. It has a normal bacterial flora that produces this normal smell. Although vaginal odor could be as a result of our diet or inflammation around the vaginal area. Inflammation can occur because of poor hygiene, but is often the result of infection in or around the vagina. One thing about this vaginal odor is that it's accompanied by redness, vaginal discharge, itching, painful intercourse, painful urination, and these symptoms could be as a result of infection or other gynecological issues. Let's move to the types of vaginal odor. There are two broad classifications of this vaginal odor. Number one is the normal and healthy vaginal odor, while number two is the abnormal or unhealthy vaginal odor. So let's start with the normal and healthy vaginal odor. Number one is fermented or sour, when the vagina smells like a fermented or soured food. This could be as a result of the good bacteria that are around the vagina. And one example of the bacteria is the lactobacillus. This lactobacillus produces lactic acid, hydrogen peroxide, and other substances that maintain the healthy environment of the vagina to prevent overgrowth of fungi and warding off of harmful bacteria. And it's this vaginal pH that is slightly acidic that makes it to smell like a soured or fermented food. The next point is metallic smell, like a copper, the smell of copper. This is as a result of menstrual blood or light bleeding after sexual intercourse because blood contains iron, and it is this iron that gives it that metallic smell. Then the sweet or bittersweet odor, like a soured gingerbread. This one is as a result of the changes of the normal bacteria in the vagina. And when there's this change, it will affect the normal vaginal pH, thereby bringing this type of odor. The last but not the least of the normal vaginal odor is the one that smells like bleach, like cleaning products or ammonia smell. This one is attributed to urine on your underwear or around your vulva. When they stay there for long, it can give you this ammonia smell. Although there are times infections can contribute to this particular smell, but if it's not really affecting you, it could be as a result of urine around your vulva or on your underwear. So let's move to the abnormal vaginal odor. When it comes to this particular type of odor, when it is fishy and foul smell, this is purely abnormal because the vagina shouldn't have a fishy smell or have a foul smell. And there are some conditions that can lead to this particular type of smell. Number one is bacterial vaginosis, which is a bacterial infection. Trichomoniasis, which is caused by parasites and is a sexually transmitted infection. Then other gynecological issues like cervical cancer, vaginal cancer, and rectovaginal fistula. These conditions can attribute to this particular type of smell. Again, you should note that during pregnancy, the vaginal odor can change as well. It may be as a result of a lot of cravings, and this will make the woman to eat different kinds of food, and this will affect the vaginal smell. Also, increased blood flow to the vagina and changing levels of the pregnancy hormones like the prolactin, estrogen, and progesterone can as well affect the pH level of the vagina, thereby influencing the vaginal smell. But during pregnancy, the major cause of unpleasant vaginal odor is vaginitis as a result of reduced immune system and changing levels of the pregnancy hormones. Even postpartum vaginal odor is common too. That is after childbirth. After childbirth, the uterus will try to go back to its pre-pregnancy state. And as it tries to go back to its normal state, it releases blood, mucus, even debris that is related to pregnancy. And this thing is called lochia. And this lochia has a particular type of smell that is metallic odor, similar to the period odor. Since it contains blood, that iron content that blood has will still reflect there. It is normal. So let's move to the remedies of this vaginal odor, or let's say the preventive measures. Number one is probiotics. Eat foods that are high in probiotics. An example of this probiotics is lactobacillus. An example of foods that contains probiotic is unpasteurized yogurt. Whenever you buy all these foods, especially yogurts, try to read the content to find out whether it contains these probiotics, because this lactobacillus is a beneficial bacteria in the vagina. They help to maintain the normal pH level of the vagina against any infection. The second one is that you need to stay hydrated. Drink a lot of water. When you are dehydrated, your urine will be concentrated, which will have that ammonia smell. But when you drink a lot of water, it will help to wash them out and eliminate those smell. The third one is that avoid tight underpants. These tight underpants will make that area, your vaginal area, to be wet. And once they are wet, it will give room for infection. Instead, wear cotton underpants that will make that area to be dry and free from any type of infection. Then wear your condom during sexual intercourse. This reduces the risk of sexually transmitted infections. Avoid douching, using your hand to clean your vagina. Yes, I want to make it to be clean. You clean everywhere. As you are doing that, you are introducing microorganisms and you're also disturbing the normal flora of the vagina, thereby giving room for infection to thrive very well. So avoid it totally. Then before and after sex, make sure you wash yourself to prevent infection. The last but not least is for you to avoid using scented or flavored lubricant, because they can cause vaginal irritation. And once there is vaginal irritation, it can be a means for infection to set in. So once you adhere to these remedies, these preventive measures, there's no how your vagina will smell bad. So my advice is that whenever you are experiencing a prolonged abnormal vaginal odor or any odor that is accompanied by discharge, itching, or burning sensation, please try to meet your doctor, because untreated vaginitis can lead to vaginal infection, and this can spread to the uterus or fallopian tubes, causing infertility on the long run. And vaginitis can increase your risk of contracting sexually transmitted infections. If you are pregnant and you are experiencing vaginitis or any vaginal odor, please try to seek medical care, because pregnant women with vaginitis or vaginal odor are at high risk of preterm birth, low birth weight, amniotic fluid infection, and other complications. So please try to seek medical attention for proper diagnosis and proper referrals for investigations to know the actual cause of the vaginal odor. But in general, antibiotics are used in the treatment of vaginal odor caused by bacteria. Please take care of your overall health to prevent any complication in the future. Eat well, stay healthy. Remember, health is wealth. Again, don't forget to subscribe to my channel if you really find this video informative.